Welcome everyone to my next section, which is about coronary circulation. So, in coronary circulation, there are different supply of blood to the myocardium, and it is the shorter circulation in the blood, in the body. So, not in the blood, sorry, in the body. So, as you can see, the posterior intraventricular arteries. It is in the back side of the heart, not in the back side, it is in the posterior side, and anterior intraventricular artery, it is in the anterior portion, and all you can see the extension of the coronary artery, the right coronary artery, that extends portion, the extended portion. See the marginal artery. You can see the circumflex artery is a extension of posterior intraventricular artery. So circumflex artery is also an extension of the anterior intraventricular artery. So the extension of anterior intraventricular extension, continuation of anterior intraventricular artery is posterior intraventricular artery. So you can see there are different junctions like this. I'm pointing. There are two junctions, and this junctions is seen in posterior intraventricular artery. So this junction is anastomosis. They are junctions of vessels inside the heart. So this is anastomosis, and this one is also anastomosis. So inside the heart there is the extension of anterior intraventricular artery. It is the posterior intraventricular artery, and the posterior intraventricular artery contains two vessel junction, two anastomosis. So there are junctions of vessels. You can see the right coronary artery. This is the right coronary artery, and this is the marginal artery, and you can see the extension of this side. This artery is circumflex artery, and you can see this is the left coronary artery. So all the arteries, now you have an idea, you have the mental image. Now we're going to explain what is the coronary circulation and how it helps us. So this coronary circulation is the primary source of blood to the myocardium. So it is the myocardium's own blood supply, and it is the shortest circulation in the body. It is the shortest circulation of blood in the body, shortest circulation. And arteries lies in epicardium. Epi means, always said, outside. So outside the heart. It's also seen inside the sulci. It is situated in the inside the sulcus. So the arteries lies in epicardium, prevents the contractions, inhibiting blood flow. So the arteries lies in the epicardium. As you can see, all these heart arteries are in the epicardium, or on the epicardium. There are a lot of variation among different people. So this circulation is different among different people. So it can cause different changes in the circulation of blood supply to the muscle. So that can also increase the rate of heartbeat, and so there will be a lot of variation that causes the arteries in the epicardium to arteries in the epicardium, their grooves and their arteries insulations will be varied. Next is the artery supply. So we are going to say about coronary supply, and we are going to say about the artery supply. So the arteries are left coronary artery, the circumflex artery, there are anterior intraventricular artery, posterior intraventricular artery, marginal artery, right coronary artery and junctions. These are all the arterial supply. So it encircles the heart in the coronary sulcus. This is encircle the heart in the coronary sulcus. So the aorta supply the blood to the left and right coronary arteries. So the aorta, the heart gets its own blood supply to the myocardium from the aorta. It's an important point. So this aorta supplies the blood to the left and this left coronary artery, this one, and the right coronary artery, this one. So it supplies the blood to the left coronary artery and the right coronary arteries. The left coronary arteries have two branches. This left coronary arteries has two branches. The first branch is the anterior intraventricular artery, this one. So this left coronary artery has two branches. This left coronary artery has this left coronary artery has two branches, the anterior intraventricular and circumflex artery. Anterior intraventricular and circulus artery. So the branches of left coronary artery is circumflex artery and anterior intraventricular artery. So you can see the points. Anterior intraventricular artery is also known as left anterior descending artery. Left anterior descending artery. Anterior intraventricular artery is also known as left anterior descending artery, or LDA or LAD. Left descending artery or left anterior descending artery. So this left coronary arteries has two branches, the anterior intraventricular artery. So we are going to say about the anterior intraventricular artery. So it follows the anterior intraventricular sulcus. So this anterior intraventricular, this portion, it contains the anterior intraventricular sulcus. So it is grooves. The anterior intraventricular artery is grooved inside the anterior intraventricular sulcus. So next point is it supplies blood to the interventricular septum and anterior walls of both ventricles. It supplies blood to the interventricular septum. You have understand what septum? Intra and ventriculars. The ventricles contains septum and it is known as intraventricular septum. So the blood also is supplied to the intraventricular septum and anterior walls of both ventricles. The walls and the septum, the blood reaches the walls and the septum, intraventricular septum, by anterior intraventricular artery. So the if anyone asks where the function of the anterior intraventricular artery, it is in the name, there shows the intraventricular. So it reaches the blood, supplies the blood to the intraventricular septum and anterior walls of both ventricles. It only supplies to the anterior interventricular septum and anterior walls of ventricles, both ventricles. Next is circumflex artery.